back in March, as a picture of COVID started to emerge, I called Dr. Flower and expressed concerns of parallels between COVID and lupus. Everything about lupus seemed like trouble for lupus. About COVID, as I said?
Yeah, no, we got it right the second time.
Well, okay. And she agreed. What she might not say, but when they said it to her, she said, Shelley, you are so right. That is absolutely the case. And I'm sure she will explain some of those parallels. But because of the discussions we had, we then started, with her guidance of course, sharing guidelines of how to live in COVID while having lupus. Remember, there was a particular push at the highest levels to use hydroxychloroquine, not only in the treatment of lupus, but to prevent lupus. Sorry, to prevent COVID, because they don't prevented lupus. Okay, so hydroxychloroquine is a life-saving drug for lupus. We as patients take it on a daily basis. So that push for hydroxychloroquine for COVID created a world shortage. But Dr. Flower, in her usual quiet, determined way, made sure that all Barbadian patients were covered. But we are not yet. New protocols have been put in place about going to the hospital and with the best intentions. So now the sick have gotten sicker and some have gotten sick. Depression has always been an issue in lupus that would cause a flare-up.
The disease is more common in black patients. So black patients have more severe disease and get the disease at an earlier age than the white patients. So for that reason, the Caribbean is an area of clustering of severe, complicated patients with lupus. We diagnose up to, say, 25 patients a year, and half of those persons will develop severe kidney disease. The type of kidney disease that without aggressive intervention may end up needing dialysis or renal transplant. And that severe lupus is the cause of repeated need for hospitalization. So we felt it was paramount to really have aggressive management of lupus, diagnose complications early, and we can't do that alone. We need to be a coach, and the patient needs to help us and to be empowered. And the Hope Foundation, under Shelley Weir's guidance, has always been about patient empowerment. So we realized that we want patients to take ownership of their disease, and we can help them do so. So the idea was to formulate a kit that they would keep at home, and they would help monitor themselves. So the kit, the thing that is important to monitor when you have lupus is your blood pressure. You have to check your urine for protein, because I will mention that though most people think kidney disease causes back pain, that's a layman's thing. Well, if you have a kidney stone, that will cause back pain, but most times kidney disease gives no symptoms until the kidney is failing. So we need patients to be diagnosed early. And a simple dipstick test of the urine for protein at home is something that can bring the patient to medical attention earlier. So we advise the patients about testing their urine monthly at home. We want them to take their temperature when they're unwell, so we know that there's a fever, and those will cause them to present for medical follow-up. So we think having a thermometer at home is important, and it's important to protect themselves from excessive sun exposure, because the sun is a trigger of a lupus flare. So we always tell them wear nice hats with a 4-inch rim, and of course because of COVID they have to wear a mask. So the lupus kit actually it helps with this self-management. It contains a blood pressure machine, urine test strips for protein, it contains a thermometer, it's got a lovely beautiful purple hat with a 4-inch rim, and it has a bonus mask.
And of course, organizations like the Hope Foundation help us to better understand the correlation between these instructions and the complexities of certain diseases and the conditions like lupus, which the doctor spoke about earlier. For that, we say thank you, as it is sometimes difficult for us to understand what our colleagues and even sometimes our family members may be going through when they are diagnosed with these conditions. That is why CIBC FirstCaribbean is happy to be part of this project and to donate funds which will allow you to acquire 100 kits needed to monitor yourselves. These kits include blood pressure machines and thermometers, and they help patients better stay ahead of their conditions and symptoms. They can do this daily by checking their temperatures and their blood pressure. This in turn will allow doctors to remotely monitor their patients so that there's an early alert if there's any acute care that may be needed. And it's so important in this pandemic as we're not always at close reach to our doctors or medical facilities. The actor Michael J. Fox once said, "Medical science has proven time and again that when the resources are provided, great progress in treatment, cure, and prevention of disease can occur." In the long run, it will be better for the country as it should be able to relieve the suffering brought on by the disease, reduce hospitalizations and the amount of persons who may eventually need to go on dialysis when there's kidney challenges.